Hello, everybody, and welcome to CHD Wise, an educational series for patients and families. We are so excited to have you join us. My name is Amy Baskin, and I'm the Executive Director here at Conquering CHD. This event is streaming live on Facebook. We also are grateful for everyone joining us here on Zoom. And when it's all finished, we will store this on our website at conqueringchd.org. On today's episode, we welcome panelists from Boston Children's Hospital and Conquering CHD Massachusetts as we dive headfirst into pediatric CHD concerns regarding COVID-19. I'll introduce our panelists in a minute, but first, I have some housekeeping notes that we need to take care of. Following this presentation, we will be answering questions submitted by you and other patients and families through our social media channel and email. We had submitted a request for questions earlier, and we'll be answering those questions tonight. If we don't get to your question, or you still have questions or new questions are brought up, please feel free to use the Q&A at the bottom of the screen, and we will make an attempt to address those. You can also use the comment section on Facebook as well. However, we have a very large number of attendees. We're very excited about that. So it is likely that we will not get to answer every question, and we ask for your patience. Our panelists will not be addressing questions specific to your child or your medical diagnoses, but will speak rather in generalities and provide relevant resources for families to learn more. As always, with the information that we've learned, we encourage patients and families to take the questions directly to their cardiologist and their care team and get specific information from them. One final note that's equally as important is this presentation is meant to be informational for families to empower you all to make the decisions that are right for your children and your care. It will not serve as a debate on masks, mask mandates, vaccination, or vaccination mandates. Any comments in the chat or on our Facebook Live surrounding pro or anti-mask, pro or anti-vaccine debates will be deleted. We want this to be a safe and empathetic place to learn. With that, I would like to introduce our panelists, and I'm going to ask Claire, Dr. DeFerranti, and Terry to turn their cameras on and welcome you to today. Dr. DeFerranti, thank you for joining us. You're the Chief of Ambulatory Cardiology at Boston Children's. You're an Associate Professor of Pediatrics at Harvard University, but I think what's equally important is you're part of the Kawasaki and the MISC team at Boston Children's Hospital. Thank you for bringing your expertise to us tonight. We also have Terry Saia joining us. She's a pediatric nurse practitioner, and she's the Cardiology Nursing Director at Boston Children's. Terry, thank you for coming and helping us understand the best ways that we can work with our care team. And lastly, we have Ms. Claire Abbott. She is an adult living with CHD and the parent of 2 children with CHD. She's the current hospital coordinator with Conquering CHD Massachusetts. And we'll get to hear from all of you tonight. We are going to start with Dr. DeFerranti, and if you'll bear with me a second, I will pull up the appropriate slides and we can get this started. All right, are you all able to see my slides okay? Great. Now it's a matter of figuring out how to change the slides. This is me, we can skip that. This is everyone joining us this evening. And then we'll begin with Dr. DeFerranti. Terry, I'm gonna have you turn your camera off here.
There, can you hear me?
Yes.
Great. All right, yeah, the slides are not quite showing up. I don't know, Amy, if you want to try and reshare maybe. And while people are, while we're retrying to share the slides, I just want to say hello. Thanks for everyone joining us tonight. I'm going to say a few words just about my perspective, and I will share some data in a few short slides, hopefully not too number heavy, but enough to kind of set the stage for a conversation. Just to re-emphasize, every every kid, every adult with congenital heart disease has a different physiology, a different set of diseases, and we want to make sure that people keep that in mind. So what I have is information about the group in general, but I do want people to recognize the really important points that Amy made about speaking with your own team and thinking about your own family and your own situation. All right, so just while we're reworking on the slides, let's see if these, how they look. COVID, you know, we've all been talking about COVID for a while and hearing about it for a while. Gosh, they don't want to share correctly, do they? So there are a couple of different aspects to COVID. So first, there's the COVID infection that none of us want to get, some of us have had, and that is generally a respiratory illness with fatigue and fever. That's kind of like an illness like one might experience like the flu, only obviously much more serious. So that's acute COVID-19. And when we think about COVID and getting COVID and catching it, that's what we're talking about. And that is really, really common, unfortunately. Much more rare, but also affecting children is this multi-systemic inflammatory syndrome in children, MIS-C. And so that's much less common. And I would say, you know, we just want to keep in mind the millions of cases of acute COVID and then this post-inflammatory syndrome. And then the third piece would be, or the third idea that we want to keep in mind is post-COVID-19 vaccine myocarditis, which we'll touch on briefly. And even less well understood in kids is this long COVID situation. So rare, we're not sure how much that is, and we won't touch on that much today, but we've all heard about that in the news, and we're definitely seeing that clinically. So why don't we go to the next slide? All right, so this is how we can think about COVID, acute COVID. So fever, cough, many are asymptomatic, and it's much more common in kids to be asymptomatic, as we all know. We test for this with that PCR test, the one that feels like it's back in your brain. There's some other tests out there that maybe are a little bit less helpful, but quicker. That acute COVID can also affect the heart. You can have myocarditis. Adults can have exacerbation or accentuation or precipitation of coronary disease. We can have arrhythmias, so electrical problems in the heart, or conduction delays, so slowing down of the electrical activity. And we can think about maybe 13% of youth have had COVID, but only 0.1% of the deaths associated with COVID are in young people. So very rare for anyone to have a serious outcome related to COVID. This is for all comers. 12.9% of youth of the total cases in youth have been in the US have been in youth, so not 12% of the total population. All right, so let's go to the next slide. What do we know about the risk of severe COVID? So when we talked about this a year ago, much less was known, but obviously over time we've been better understanding what are the risks of not having an asymptomatic case, but having a more serious illness. What we have out there are a few studies. This was a pretty large one of over 5,600 children with acute SARS-CoV-2 or acute COVID. And only 2% of those actually required intensive care and mechanical ventilation. So pretty rare to have anything severe. And most of those had some type of comorbidity. So this is where we start to think about our own congenital heart disease patients, cardiomyopathy patients. The most common comorbidities were not those diagnoses, but were obesity, hypertension, and other diagnoses, but congenital heart disease was among that group. And of the very low rate of mortality in this particular study, 3/4 had actually a comorbid condition, although none in this study had congenital heart disease or cardiomyopathy. So there are some factors that we now understand that predict risk. and they're listed there. There are rare ones like immunodeficiencies, cancers, and other syndromes, diabetes. So those are the things that we know might be associated with greater risk of having more severe disease. All right, so let's go to the next one. All right, so there is a large series of adults with congenital heart disease, and this was from 58 adult congenital heart disease centers, which tried also to describe the risks associated with SARS-CoV-2 in adults with congenital heart disease. And that series reported a mortality rate of around 2%, which is what the general population might see. When that group tried to drill down into what would be the risk factors, or how could we understand which groups were more at risk, it was physiologic stage based on the adult ACC/AHA guidelines. So how wasn't your diagnosis, but was your physiology. And so the things that we saw in that other group included cyanosis, so a saturation less than 90%, pulmonary hypertension, renal insufficiency. So being unwell with your congenital heart disease was the key factor here, not what was your anatomic diagnosis or what you were specifically born with. All right, let's go to the next one. So what do we know about multi-system inflammatory syndrome in children, or MISC? So this is the much more rare condition that comes after acute COVID. So 4 to 6 weeks after is the most common time for this to present, although there is a range. And we think there are something like 5,000 cases described. And this would be more likely to affect children, although there are some young adults who have this. Not related to congenital heart disease diagnoses per se, shows up a little bit like Kawasaki with fever and rash, and you can have GI symptoms, and you need to have multiple systems involved. And there's a lot of inflammation going on in this, and the pictures to the right are trying to remind me to say that your heart, the squeeze of your ventricle can be diminished. You can also have coronary aneurysms, which is seen in Kawasaki disease. And conduction abnormalities. So quite uncommon, particularly focuses in kids, although there are a few adults described with this, and comes after SARS-CoV-2 infection. And children may be asymptomatic in the initial infection of COVID and then develop this afterwards. All right, and let's go to the next one. I promise we are not too far from the end of the data part of this whole presentation. So what about vaccinations? So what we want, these are from the CDC, and these are some facts that we want to share about vaccination. It's recommended for everyone age 12 years and older, unless you have an allergy. They are highly effective in preventing serious outcomes from COVID, including the severe disease outcomes, hospitalization, and mortality that we mentioned that are rare in children, but are still a factor. And they protect against all the variants that we are familiar with, including the Delta variant, which we're all concerned about at the moment. The Pfizer is approved for 16 and older, completely FDA approved, and then there's emergency use authorization for 12 to 15 for Pfizer, and then there are the Moderna and the J&J vaccines for older individuals. So let's go to the next one. So what about this vaccine-associated myocarditis? And that one, so we lost that slide, but I can tell you what we know about this. This is a very rare sequelae, more often seen in males than females, more often after a second dose of the mRNA vaccines, and presents usually 2 to 5 days after a second dose of vaccine with fever, chest pain, sometimes shortness of breath. and we can diagnose it with lab tests and cardiology testing that you will be familiar with. Most of the individuals that we've seen in our institution and in fact across the country have mild disease that gets better quickly with really observation or sometimes some treatments. But you do need some follow-up, and we would consider watching you carefully for 3 to 6 months, just because we're learning more about it. There have been 2,500 cases reported, 740 confirmed, and many of those are beyond the pediatric age. And I have seen this and seen kids get better with it, but it's pretty uncommon. All right, so let's go to the next one, which is about sports. All of our kids, or many of our kids, are interested in some type of physical activity, and I spend a lot of time enthusiastically recommending it in one form or another to our patients. But after COVID, how safe is it? What do we know about that? We've tried to rapidly increase our understanding of that, and what we do find is that those who have very mild symptoms of COVID or no symptoms of COVID can really be checked by their pediatrician, usually with a screen over the phone, and do just fine. And those who have been quite ill with COVID or with MIS-C need to have more attention by a cardiologist, and we sometimes do some extra testing and do some counseling about the best way to return to play. So this has occupied a lot of time with my partner, Terry Saia, and our nursing staff, trying to decide and help families figure out what's the best way to navigate these questions. So just a couple more slides, and then we'll get to your questions. So what do we know about the other sides of the pandemic? We've all experienced this, and our kids even more so. The COVID pandemic has disrupted our school routines, our regular care routines, your congenital heart disease kiddo routines, some surgeries, and especially in the beginning of the pandemic, this was really burdensome. School has been closed. This, for some, has caused a lot of emotional distress. For some vulnerable kids, has put them in more difficult situations, decreased their access to healthy food through school lunch, education, lots of depression and anxiety in our youth and our college students, and in adults too. We see this in our ER. It was really quite notable in the highest peak of the pandemic. And we think our kids have lost some education, a couple of months or even more of their experience. So, so the vaccine allows us some more freedom to be out and about in the world with a little bit more confidence and more safety. However, why don't we go to the next slide? All of these decisions around whether it's a question of getting a COVID vaccine, whether it's a question of sending your child to school, whether you're taking your own mask off, going to the grocery store, getting together with friends, or even going to a larger event, really are personal decisions, and we have to make them the best we can in a situation of incomplete data, but knowing the most that we can about our environment, about the prevalence, about our household and who's at risk in our household, about our own or our child's personal health and their own risk factors, and about the downstream consequences. So this is the challenge that we all face, and especially for our kiddos with congenital heart disease. All right, so these were my key points, and I'm going to stop talking after this, but in general, overall, I am hopeful that my patients and my colleagues are vaccinated if they're eligible, and I don't view congenital heart disease as a reason not to get vaccinated. In fact, I view it as a reason to get vaccinated. I suggest that family members get vaccinated too, and get your flu shots, keep up with your oral care to stay as healthy as possible. We don't see a higher risk in most of our patients with congenital heart disease, although there are some caveats or exceptions, as we've talked about today. And we should all keep washing our hands, wearing our masks when it's recommended, and being mindful of staying home when we're sick. So I'll stop talking now and leave it open for the rest of the presentation.
Thank you, Dr. DeFerranti. We do have quite a few questions coming through, and we will address those. However, I am excited that we have Claire Abbott, who's going to share a little bit with us next.
Hi, everyone. Thanks for having me. It was a kind of a nice transition from Dr. DeFerranti to me when you spoke of working in a situation of incomplete data, because that really is where a lot of parents find themselves. And frankly, if you're a parent of any child, with or without CHD, you're pretty familiar with making decisions on a daily basis about their welfare, about their happiness, and you're kind of always looking for information to help you guide those choices. I was just like, even last night, sitting on the couch, trying to make a decision about my heart healthy son, about whether to let him not sit at the nut-free table at lunch anymore because he has a severe peanut allergy. And I was weighing the risks of, him he might eat a peanut versus giving him that additional social independence and so forth. And so this was my decision as a parent, and it wasn't clear to me. I had to take a chance. And COVID has really brought decisions like this to everybody's kitchen table, if you will. What's interesting to me, though, as a parent of 2 kids with congenital heart disease is really how familiar this all feels. This is not our first rodeo. If you have a child with a congenital heart defect of any level of complexity, you have been asked probably multiple times to make a decision that affects your child's health. That ranges from, yes, we know this will work, to we think this will work, to this may or may not work, but we might want to try it. And congenital heart disease is pretty unique in that way. And COVID sort of brings that same level of insecurity or indecision to everybody. My 2 kids with CHD are both in elementary school right now. One is 2 years post-op, and she just started kindergarten after being home since the pandemic hit. The other hasn't had to have any interventions yet, but he's entering his preteen years and he's under pretty close supervision. He's starting 5th grade after a year of hybrid learning, and he's going to be the starting goalie on his hockey team. None of these decisions were ones that my partner and I made lightly, and none of them are risk-free. So for us, it comes down to really 3 things. First, we really look at how healthy and stable our kids are right now. And this includes both their heart health and their mental health. Second is how healthy is our community? What is the vaccination rate? What precautions are their schools and their sports teams taking? And are they in accordance with CDC's guidance? And third, what do their care teams say? We've been in pretty close communication with both their pediatrician and their cardiologist. And like any CHD parent, I'm keeping really close tabs on the research coming in around COVID and the data that continues to trickle in, including several studies that Dr. DeFerranti just mentioned. And I asked them about those. And I'll just end by noting that 20 months into this pandemic, COVID appears to be affecting CHD kiddos similarly to other respiratory viruses, which we have also experienced. One of my kids has been hospitalized twice for RSV. So the precautions we're taking are similar, the feelings are similar, but in some odd way, that brings me a little peace of mind because I've been down this road before. And I'm definitely counting the days until that pediatric vaccine is available for that extra layer of protection. I'm happy to answer more questions as they come in and talk a little bit more about how we make these decisions, but want to open it up to see if there are any specific questions, Amy.
Yeah, fantastic. So I want to stick on this idea of weighing the risks a little bit. It's by far the most common question that we've had. And Claire, I think you did a really good job outlining them. Sarah or Terry, do you have anything to add about this risk and balance?
Sure, I'll jump in. I think, from a nursing perspective, our staff has spent a lot of time on the phone trying to do very therapeutic listening, triage, and education with families. And as Dr. DeFerranti said, every child is a little unique. And we're trying to give people the right information and evidence to make the very best decision based on their child's unique situation, the other risk factors that may be present in the community or within the family. And I think that the time spent on the phone and in person discussing this in a very thoughtful manner has been very, very helpful, and I think very reassuring in general to most parents.
I would first thank Terry and her amazing team and all the providers who, are maybe not on this webinar, but are providing support to you all. And I would also say it's really important to bring these questions to your team. I can't tell you the number of visits that I've had with patients and families where we do the whole visit and I can tell there's something left, and it's actually this really big and important question that's not at all related to the reason of the visit ostensibly, but is, what do you think? And I was holding off until I spoke with you, just getting all these opinions. And I get that. I think that's really important. The other thing I would say is if you make one decision today, it's not the end of your decisions, for good or bad. So to put it simply, if you let your teenage son bike over to his friend's house to hang out outside, and maybe he goes inside even though he really shouldn't have, but says the windows were open, okay, you made your best decision that day, and the next day you might say, all right, let's have a conversation, or maybe you won't go there this time. So each day is a new day, and no decision today means that you can't change your mind tomorrow. We all have to respond to the situation in front of ourselves, and also the situation with regard to the health information that we have.
Great, thank you. Claire, do you have anything else that you didn't cover that you want to add?
I would just add, I really appreciate what you just said, Dr. DeFerranti, about the dynamic nature of decision making. The decisions that we made on behalf of our children 12 months ago, 18 months ago, are different than the ones we made 2 weeks ago. My husband and I have always thought about it like a bucket, like a risk bucket that we have to fill. And once that bucket is full, we don't add anything else to it that would increase the risk of them getting COVID. Because to us, there's a greater risk of them suffering significant side effects of COVID than there is of them getting COVID itself. Like they're no more likely to get COVID than my heart healthy kid. So our job is to keep them from getting COVID. So that risk bucket for us today includes sending them to school in masks, participating in a limited number of sports or activities that are either outdoors or closely managed by COVID precautions, and socializing with a small group of trusted friends outdoors only. Activities that do not go into that bucket include things like dining indoors, unnecessary public transportation, or spending time with any unvaccinated adults, including family members. And I want to acknowledge this is my risk bucket, and those decisions can be very hard to make for some families, especially if you live in a community that is not embracing mask mandates for schools, or if you have family members that refuse to get vaccinated, or if you work and you can't find safe childcare. Friends of ours have gone in front of school committees and advocated for mask mandates on behalf of their children who either have congenital heart disease or are immunocompromised. And I myself have advocated with my employer to issue a mask mandate so that I feel safe coming into the workplace on behalf of my family. So it's not easy. I'm not trying to say it is. And our risk bucket probably looks different than another family's risk bucket because of those environmental factors. But I'm hopeful that we're headed in the right direction as a lot of state and federal mandates start to take effect, and we start to see the increase of the vaccine distribution. So that's our hope right now.
Great, thank you, Claire. Sorry, I'm taking notes. There's lots of great questions coming in. So let's move on to the next question. This one is another one we've seen a lot from parents that contributed via social media. And it's just, if you can summarize again, I know, Sarah, you went through the data, but just how, in general, how are kids with congenital heart disease, based on your experience, Terry and Sarah, how are they faring when they do get COVID?
Yeah, that's a really great question. And I get it a lot, and I feel happy to talk through the data and then give you my own clinical experience, which is just a small slice. But I would say the data we have suggests that those who are most significantly affected, either with heart failure symptoms or with pulmonary hypertension, or with significant cyanosis, are going to be at slightly more risk for more severe disease if they get COVID. A second question is, who's more likely to get COVID? And those would be the folks that maybe have an immunodeficiency. And so that's why there's been talk about trying to augment their immunity, and that would be a moderate or severe immunodeficiency. My clinical experience is that for the majority of the patients that I'm seeing, they're tolerating it really well. I mean, many are not feeling great, tired, achy. A few have had a little bit of a fever, but it's mostly fatigue and not too severe disease. And we don't have any evidence to support that on average, a repaired congenital heart disease patient has a worse outcome. So I would say, be careful, communicate with your team, and over again, like, don't just call and say, I have COVID, but if you're worried, if things are not going in the direction that you need, maybe you need to be seen, maybe you need a daily phone call, maybe you need additional care through your pediatrician, so feel free to keep reaching out, but we have not, we all worried about what our patients would experience, and for the most part, we've been pretty reassured.
That's fantastic news. Terry?
Yeah, Sarah, I would agree with you. And sort of the other side of the spectrum is that I work very frequently with children and adolescents coming in for procedures. And by and large, when we've been screening for COVID pre-procedurally, and we've gotten a very rare surprise positive, the families have been pretty much unaware that the child had had the illness. So, and these are our procedure patients who tend to be, a little more vulnerable, which is why they're coming in, especially in the beginning of COVID. So we've seen, just a handful of positives over the last 20 months. And among those children, they were actually asymptomatic. The rare child that has been tested positive, who we have canceled before they've come in, have not required hospitalization. It was care at home, mild symptoms, fully recovered. So among that group, it's actually gone pretty well.
Thank you for that. We do have several questions very specific to the neonatal population in less than a year. Can you address how this is impacting that specific age group?
So there does look like there's a very small but slightly higher risk of severe disease in the very young, not specific to congenital heart disease per se, but prematurity and very small, very young ages. We'll have to see how that all plays out, and I don't always get to see those kiddos because they're not necessarily with congenital heart disease, but from reading the data, that does seem to be a slight risk. I think there were some questions about vaccines for that group. Under 12 is still evolving. We're all really eagerly waiting more data. My understanding is that the trials, the outcomes were, the trials were extended slightly because they want more information, particularly as we are understanding more about this post-vaccine myocarditis. And I appreciate that. I think that's important. The earliest date we might get something was optimistically said, I think, around the end of October. Others are saying the end of the year. We're all waiting and waiting eagerly for that, for sure.
Yeah, thank you. We have several questions on different risk factors. So I'm going to ask two different questions. One is related to respiratory risk factors. Some are curious about children with conditions that have lower SATs at baseline. And then someone else asked a question about hypertension. And when you referenced hypertension, was it benign or was it respiratory hypertension?
Yeah, what we know suggests that saturations under 90% are slightly higher risk. That's probably an amalgam of lots of different conditions. So it's hard to say exactly, what the congenital heart lesion was around that, but when we were able to, folks were able to pull through the data, that was a number that kind of did come out of the analysis. With regard to hypertension, so pulmonary hypertension was definitely a risk in the congenital heart population in the ACHD or the adults. And I think most of us, 36 months ago would have predicted that as being our more vulnerable group of patients. But systemic hypertension, or the one that might be in that benign category, I mean, many more people have systemic hypertension. It's associated with obesity. It's seen in adults with coronary disease. So that's the other side of the spectrum, not congenital heart disease. And that's definitely a risk. And you can see that in adults with congenital heart disease as well, but a lot of those data come from the adult, generally healthy population.
Great, thank you very much. There's also a question about, actually a couple, about risk factors related to medication. Are there any medications that can increase risk or that families should be concerned about?
Not aware of any medications that can increase risk. The situation around the ACE inhibitors is pretty confusing. There's some receptors that seem to be a feature of the pathophysiology of COVID, and for a little while we worried that people were at greater risk, and then we thought maybe the ACE inhibitors would be a lowering of risk. I don't think that it's turned out to be either way, although that field keeps changing every time I turn around. So,
great, thank you. Evolving, right? That's the word we like to talk about. It's continuously evolving. So you guys did a great job talking through the risk evaluation process. Any thoughts about risk evaluation for vaccines? I know it's really early, but a lot of people are asking, how do we decide whether or not to get our child vaccinated when that opportunity is presented to us?
So I think it's a good topic to come back around to. So COVID is way more common than the adverse effects associated with COVID vaccine, what we know now, even if you include the muscle aches and pains, which I got when I got my Moderna shot, or the fevers that some people experience. And the adverse outcomes or the bad things that can happen from COVID, in my view, and in most people's view, outweigh the risks associated with the vaccine. There were some questions around younger kids and about the UK's decision not to approve the medication, the vaccine in younger children. I think the thinking there has been, well, kids don't experience such significant disease, and so maybe the risk benefit differs there. Part of our thinking really needs to include getting COVID and sharing it with others. So if I think about a family where there's a grandparent or somebody who is unwell for other reasons, maybe immunodeficient or more vulnerable, then we want to surround that person with safety. And so I think it's important to keep that piece in mind. The other piece is, it may be that other variants will show up, and it would be good to stop this disease in its tracks.
Yeah. Thank you. I appreciate that. We have an interesting question about immunity and antibodies. So can those be transferred through breast milk for infants who are still taking breast milk? Are you aware of anything related to that?
Okay, now you've reached the end of my knowledge on that. I don't know. I would guess breast milk is best, but I'd have to go look that one up.
Fantastic. There are a lot of excellent questions that are very specific to a diagnosis and to your child's unique physiology or concerns. So I am going to just strongly encourage that anyone who's asking these questions, be sure to take the information you've learned tonight and take it to your doctor and your care team because again, we're not able to talk specifics, but we're able to give just a broad understanding of what's happening and what we're seeing. Before we wrap up, I do have another question. Terry, you have been the liaison for many conversations with patients and families. And I would love to hear from you and all of us, but to talk a little bit about, we are giving this advice to now go talk to your care team. What does that look like? What are some things that patients and families can do to facilitate that conversation and feel confident in having these discussions?
Sure, happy to talk to that. I can only speak to the way that we've been managing the phone calls in Boston, but do have some knowledge that many of the cardiology practices across the nation operate the same way, and that there are typically nurse practitioners who are partners with our MD colleagues in trying to provide this triage, education, and advice. And typically, the way that we've been managing these calls is they come into our general cardiology line, and our PER, our administrative colleagues, will take a message and a phone number. And typically, we want to look up the record first so that we understand the physiology, to Dr. DeFerranti's point, and consider every child, every patient uniquely. And then it's a matter of gathering some information about what's happening, sort of in the community. Where does the family live? Are there other people in the family who have other medical issues that need to be considered as part of the conversation? And really just trying to provide the most up-to-date information on what we know about prevalence, what we're seeing in terms of potential risk factors and how that applies to that patient. And really being very data-driven and evidence-based in the guidance that we're offering. And then it comes down to supporting parents in their decisions. And I really loved the description of the personal risk bucket, because I do think it differs from every family and perhaps every member of that family who's going out into their own little unique world, going to school, going to work. And how do you take all of that information and apply it to your own personal situation? In general, we've been very supportive of the vaccine because we do follow the science, and the evidence suggests that the risk of the disease is far greater than the vaccine itself. But we also want to be supportive to parents who may have a different decision and try to counsel on how do you create safety if you choose not to have the vaccine, and it is choosing what situation you go into. I will bring up a question that may be on many parents' minds about, is congenital heart disease a reason, a contraindication of going to school? And we have not supported that in our facility to say, because you have congenital heart disease, you should not go to school, because of those other things that Dr. DeFerranti spoke about, the need to learn, the need to socialize. But again, every community is a little different. So although we're not putting a message on the web saying children with congenital heart disease should not go to school, we are considering, every child, every patient uniquely. I hope that it helps and answers your question.
Yeah, thanks, Terry. Claire, you want to add to that?
Yeah, it strikes an emotional chord in me because as a parent, whenever we're asked to make one more decision, we worry about making the wrong one for our kid. But again, I just want to go back, this is what we do as CHD parents. And frankly, we've been doing this a long time. We weigh the risk and we try to ensure that our kids are positioned to live their best lives each and every day. So for me, that that's the risk bucket that I've filled to make sure that my 5-year-old can go to after school and just like blow people away. And my 10-year-old can be the starting goalie on his hockey team this year. And it means they're not doing other things. But it also means that they get to visit their really high risk grandfather too. So it's just different. It's hard. I believe that the vaccine will change our risk bucket in a really profound way, even further. But I acknowledge that these conversations are personal, and I really appreciate and hope that everybody has care providers like Dr. DeFerranti and Terry to have those conversations with them as they struggle with these.
I could just add one thing. There was a comment on our question around support around the stressors of this prolonged, not normal. And I think this is being felt in people outside of congenital heart disease families and also inside. And it's a real challenge. The folks that are usually there to help us with this are also overburdened because it's so common. But I would urge you to reach out and look for resources as best you can, because it is really hard. There aren't perfect answers out there, but the stress and strain of this sort of continuing pandemic, it just keeps going. And I think certainly the choices that I made with my family at the beginning and the choices I'm making now are very different, because I see the strains on my kids as well. So.
I agree, Sarah. I think it's been a very fluid experience for all of us, whether we're patients, parents, healthcare providers. And I think the silver lining for the CHD community is that people tend to be very well connected, and that, if you make that decision to get vaccinated and if you've got worry around it, you have a care team that can help, in the moment, triage any acute concern around that. I think where it's been a little bit more scary, quite honestly, is for the patients who have no contacts, who got COVID, got cardiac symptoms, got post-vaccine myocarditis, because they didn't have the same experiential knowledge that many of you on this call have to draw from. So, these calls come in very cold. And I remember one day taking a call from a mother whose adolescent boy had been vaccinated a few days earlier, who had chest pain and shortness of breath. He was an athlete, but had no heart disease, and, also had fever. And we were, by then we had gathered enough knowledge that that's just like, oh, this sounds concerning to me. We directed them to the ED, and he got admitted, and he did have myocarditis. But that family came into this with very little knowledge. So I think feel empowered by what you know, because most of you on this call, just being on this call, you're knowledgeable, you're seeking out evidence, you're seeking out information from the experts. And I think that's incredibly empowering. And maintain those connections with your local team, because they're so important, and with your pediatricians who can help you navigate.
Yeah. I would say also that, for all of the calls that Terry's had to field where somebody did need to go to the ER, there have been so many more of good outcomes where the evaluation was reassuring and the story was fortunately a false alarm. But those families felt more challenged because they're reaching out calling cold, for sure. It's a good point.
Yeah. Well, thank you all so much for bringing your expertise to the table and honestly shining a light into a really tough spot for a lot of parents with children with CHD. Thank you for the hope that you've offered and the wisdom and the encouragement. And I just want to remind everyone again, please take your concerns, your questions. They're all wonderful and valid. Take them to your care team and have these conversations continue. Don't let it stop here. Because as everyone has said tonight, it's very fluid, and each week, each month, we're learning more so we can ask the same questions and get new answers every time. So Thank you all. And I'm going to just share our last slide one more time so that folks can see the website. Please, if you have any follow-up questions, visit us at or you can email us at chdwise@conqueringchd.org. It's very possible for us to incorporate some of these answers in a written format when we display the recorded version of this webinar on our website. So conqueringchd.org is our website, and then feel free to email CHDWise. For those of you who ask questions, we will keep those questions, and we can put some of those answers together as well in writing. So again, thank you all, Dr. DeFerranti, Claire, Ms. Saia, thank you so much. And thank you all for joining us this evening. Take care and be well.
Thank you. Good night, everybody.
Good night.
Good night, thanks.
Thanks.